Welcome to our channel. Today we are talking about the tests you can do if you would like to check if at all you are fertile or you are not fertile. The tests for fertility. What investigations can be done to determine fertility? Gerard Massa, the health educator, is the name of the channel. I welcome you for today's lesson, and we are talking about the tests you can do to check your fertility. So without further ado, we are talking about the tests you can do to check your fertility. We have said that when you would like to know whether you are fertile or you are not fertile, there are some special tests which need to be done. The tests we are talking about here, both are radiological and they are serological. When I talk about radiological tests and serological tests, specifically we are talking about testing for fertility whereby X-rays or scans can be done on your system. And stay with me, we are going to talk about the specific blood tests, the specific X-ray tests which will be done on you. So if you would like to know whether you are fertile or you are not fertile, the first very important test that will be done on you is to do what we call a fertility hormonal screen test. The first test for fertility is what we call the fertility hormonal screen test. When we talk about the fertility hormonal screen test, this is a test which is done to check or to assess your hormones to see whether they are within the normal ranges or they are not within the normal ranges. If you are a couple, you have tried to get pregnant and things are not working out, it is high time you do a test. You check your hormones to see how they are, whether they are within the normal ranges or they are not within the normal ranges. And the first test or the first hormone we shall look at is what we call progesterone. When you would like to know whether you are fertile or you are not fertile, it is very important to know the levels of a hormone known as progesterone. We shall talk more about progesterone later on as we proceed. And the next hormone is what we call LH or luteinizing hormone. And then the next hormone is what we call the follicle stimulating hormone. Next hormone is known as the E2 or the estradiol. E2 or estrogen is a hormone which is actually produced by your egg cells. What happens is that in your brain there's a part known as the hypothalamus. There's a part in the brain known as the hypothalamus. The hypothalamus tells the anterior pituitary gland, abbreviated as an APG. It is the hypothalamus, a part in your brain which tells or which stimulates the anterior pituitary gland to produce the two hormones. The first hormone is known as the FSH, and then the next hormone is known as LH. So the anterior pituitary gland the hypothalamus stimulates your anterior pituitary gland, and then the anterior pituitary gland will produce two hormones. The first hormone is known as FSH. FSH in full, it means the follicle stimulating hormone, or it is the hormone which stimulates your eggs so that they grow. Just like you can put a seed in soil, when you just as you can plant a seed in soil and then you water it, you apply manure, you do everything to make sure that the seed grows. Specifically, what is responsible, or the hormone which is responsible for this function, is what we call the follicle stimulating hormone. So if you would like to know why you are not getting pregnant, why you are having issues getting pregnant, you've taken all the drugs and things are not working out, it is high time you discuss with your doctor about testing for hormones. Because what happens is that you cannot just show signs, you cannot sit there and see that maybe this hormone is not balancing. What you need to do is you need to do a blood test to check for these hormones. And when we are to explain something here, very brief, you realize that when these two hormones have been produced, that is FSH plus LH, when they have been produced, they are going to travel to your gonads, or they are going to travel to your ovaries. And when FSH and LH reaches your ovaries, assuming this is an egg cell, or assuming the ovaries have produced an egg, there's going to be changes which are going to take place. We said that FSH and LH are produced in the brain. When they travel through the blood up to your ovaries, they are going to act specifically on an egg, or they are going to act on your egg. So when FSH and LH act on your egg, the end result is going to be that two hormones are going to be produced. The first hormone is known as progesterone. And then the next hormone is known as estrogen, or abbreviated as E2. So when FSH, that is when the follicle stimulating hormone acts on your egg, there's going to be release of estrogen. FSH brings about the release of estrogen, whereas LH, known as luteinizing hormone, acts on your egg, and then it brings about the release of progesterone. Now, estrogen is very important because it plays very many roles. It prepares your womb, it prepares your uterus, it brings about the thickening of your uterus so that when implantation happens, implantation becomes successful. So that when the egg attaches onto your womb, there's going to be growth which will take place. When you have low estrogen, or when you have a dysfunction in the levels of estrogen being produced in your body, there's going to be pregnancy difficulties. You could actually end up with infertility. And then when progesterone has been released, this is normally in the luteal phase of your menstrual cycle. That is, immediately after ovulation has taken place, progesterone is going to surge. It's going to increase in its levels. And if at all this is your womb, if this is your inside of your womb, progesterone being released in your uterus is going to make sure, or it's going to make sure that when the egg has attached onto your womb, the egg grows into, actually the fertilized embryo grows up to that formation. It grows into a successful pregnancy, in simple terms. So what brings about a successful pregnancy in your body, if at all you have undergone fertilization, is this hormone known as progesterone. Progesterone is a pregnancy-friendly hormone. It makes sure that your pregnancy goes on to become successful. If you have insufficient progesterone hormone, then there's going to be repeated, or there's going to be miscarriages which will be repeated. Miscarriages mean, or to have a miscarriage, it means basically you are not able to carry a successful pregnancy beyond 20 weeks. So if you have tried to get pregnant, you are a couple, you've taken all the drugs, you've taken Clomid, you've taken Letrozole, you've taken all the fertility drugs, but things are not working out, you have an issue of unexplained infertility, then it is high time you do a fertility hormonal screen test. And after doing the fertility hormonal screen test, your doctor or your specialist will be able to interpret for you your results, and then of course give you the best remedies, the best treatments, the best thing on the results of your hormones. You can also have a private chat with me on my channel www.gerardmassa.thehealtheducator.com, and we shall share more about how you can get pregnant faster naturally. We talked about the other tests of fertility, or to check whether you are fertile or you are not fertile, and we said that the next test is an X-ray test known as the HSG, and we said that the HSG test specifically, it means the hysterosalpingogram. HSG means hysterosalpingogram. The hysterosalpingogram test is a test whereby they will check for your fertility. They will get a chemical or a dye, a contrast media, which will be introduced into your private parts, your V, and then this chemical goes upwards into your womb and into your fallopian tubes, and then when it reaches your fallopian tubes, where there's a blockage either due to free fluid or adhesions, then it will collect there. Results or pictures will be taken, and then where this contrast media or where this chemical has accumulated, that is the point of blockage, and then the report will show where the blockage is. Your doctor will base on that to give you the best care, whereby they may do tubal unblocking in the theater by doing a simple procedure also known as a laparoscopic operation. So we are proceeding with our tests, and we have said that we've talked about the blood tests, whereby we said that your hormones can be checked in your blood. We also said that X-ray tests like the HSG scan can be done. There's also another special test known as the hysterosalpingogram. It's also very important. And then the next test which will be done to assess your fertility is what we call the pelvic ultrasound scan, whereby more attention will be given to your ovaries, to your ovaries, to see what could be happening with your ovaries. When we do this pelvic ultrasound scan, if at all this is your ovary, there's going to be follicles which will be seen. Follicles are those shells where the eggs are kept. So ideally, you are supposed to be having a dominant follicle, which is also known as the Graafian follicle. That is, when you do this pelvic ultrasound scan on the 14th day or when you are ovulating, you will be able to see a dominant follicle which is actually getting ready to rupture, which is actually getting ready to undergo ovulation. If you do the pelvic ultrasound scan on your 14th day, that is on the day when you are ovulating, or the day, actually you can do it on the 13th day. When you do it on the 13th day or even the 14th day, and basically we are supposed to be seeing a dominant follicle, and your scan shows that there's no dominant follicle, you do not have actually an egg which is going to undergo ovulation, then it means you could be having issues with ovulation, and that's when we need to correlate the results of the pelvic ultrasound scan test or the pelvic ultrasound scan with your progesterone levels. Remember, progesterone increase means that implantation is actually taking place, or it has taken place. Gerard Master, the Health Educator are my names. Remember to subscribe to our channel. If it's your first time on our channel, I welcome you, my friend. You are most welcome on our channel. Watch all our videos. I believe you'll get a video which will give you the tip you've been looking for in regards to fertility, in regards to getting pregnant faster. Next test is what we call the urine culture and sensitivity test. Urine culture and sensitivity test, a sample of your urine will be taken, whereby results will come out, and these results will show whether you have been having an infection. For example, if you are having chlamydia or you are having trichomonas organisms in your system, in your urinary system, then these will be treated, and then you'll be able to get pregnant faster. When we talked about the pelvic ultrasound scan, we forgot to talk about PIDs. When there's free fluid in a part of your womb known as the pouch of Douglas, and then you have lots of free fluid in that part, then there are high chances that you could be having a pelvic inflammatory disease. Have yourself a fantastic and healthy day. I look forward to talking with you on my channel. Just go down below this video in the comments and then ask me all your questions. I will answer all your questions in regards to fertility, in regards to how you can get pregnant faster naturally. You can also visit our website. We do offer free ultrasound scans to all the most vulnerable pregnant mothers in our community, and we are looking for your support so that we can reach more of these pregnant mothers. So you can support us by donating on our channel. You can support us by donating on our website. Any amount is welcome. whatever amount you donate will be directed towards reaching out to all the pregnant mothers so that we can share with them this information you are getting here. Have yourself a fantastic and healthy day. May God bless us all and take care. Bye-bye. How to get pregnant faster with one fallopian tube. How you can boost ovulation with a simple recipe. Did you know that you can get pregnant faster with one fallopian tube? Did you know that you can boost ovulation? You can boost your chances of getting pregnant with just a simple recipe, with something very simple that you have it even in your nearby market. Yes, in this video today we are going to talk about how to get pregnant faster with one fallopian tube. And yes, if you are new here, you are most welcome. I welcome you to our lesson for today. I welcome you to this channel. On this channel we talk about the ovulation calendar, we talk about the ovulation calculator, and then we do also give pregnancy tips on how you can get pregnant naturally. Gerard Massa, the health educator, is the name of the channel, and I welcome you, my friend. Stay with me, watch this video to the end. We are going to talk about how you can get pregnant faster with one fallopian tube and how you can boost ovulation with just a very simple recipe. It has worked, it is working for many couples. It will work for you to watch this video to the end, and we are going to talk about all this after this short message. Don't leave. Thank you, my friend, for staying around. We are talking about how you can get pregnant faster with one fallopian tube and how you can boost ovulation with just a simple recipe. So what is happening is that we shall begin by understanding the ovulation calendar. Whenever you would like to know, whenever you want to know the days you are most likely to get pregnant, remember you only have to count from the first day when you saw your periods. If you start seeing your periods on maybe the second day of this particular month, then remember you can easily get pregnant very easily. Thank you, my friend. So we are talking about how you can get pregnant faster by first of all understanding your ovulation calendar. The most important thing is that when you are calculating your ovulation day, you always have to begin from the first day when you have seen your menses. And then when you begin counting from the first day when you saw your menses, then there's going to be the 14th day. That is when you are actually going to be ovulating. So if you are a woman out there and you have a regular cycle, and even if your cycle is irregular, still you just have to pick out a particular month which is really okay, which has been consistent, and then you basically have to count from the first day when you saw your menses, count up to the 14th day. When we talk about your cycle or your menstrual cycle being regular, specifically we are talking about knowing that the menstrual cycle is divided into two phases. We have the follicular phase, and then we do also have the luteal phase. So when you have your periods on day 1, then you see your periods on day 2 and then day 3, what you need to do is basically count from the first day you saw your periods, that is day 1, and then count up to the 14th day. And on the 14th day, that is when you are going to be ovulating. That is when you are most likely to be ovulating. So what happens is that the 3 days leading to ovulation, during the 3 days leading to ovulation, there's a release of a hormone. This hormone is known as luteinizing hormone, also abbreviated as LH. This hormone stimulates the whole process of rupture. So what is happening is that when you see your menses on day 1, then then there's going to be a release of a hormone known as luteinizing hormone, and this hormone is specifically responsible for the rupture of a mature Graafian follicle. A mature Graafian follicle is basically a mature egg. So when we take a look at this diagram, you realize that the whole of this is what we call the reproductive system. This is the reproductive system of a woman. It has actually several parts, but we shall talk about them in a nutshell. We have one ovary this side, and then another ovary, and then we do also have the fallopian tubes, and then we do also have the fallopian tubes attached around here, and also these ligaments which support the ovaries. So the whole of this is basically layers of tissue. It's known as the myometrium, and then the outer thin layer is what we call the perimetrium or the epimetrium, and then we have the inner layer which is known as the endometrium. What happens is that when an egg has been released, it's going to grow. When a woman has just seen her menses, when a woman has just seen her menstrual cycle, or when a woman has just seen her periods, there's going to be growth of these eggs from a very small size, and then it goes on growing until it matures. So the first stages when the egg is growing, basically this is known as, the first stages when the egg has just started growing, it is known as the follicular phase. Follicular comes from the word follicle, whereby there's growth of a small egg. It goes on growing until it matures into a ripe egg known as the Graafian follicle. The whole process of maturation, the whole process of growth of this egg until it reaches this point of being very mature, ready to be released, this whole process is supported and it is stimulated by a hormone known as luteinizing hormone, working together with another hormone also known as estrogen. But luteinizing hormone is the most important hormone here. It plays a very big role in helping the maturation and then the rupture of this mature egg. When this mature egg ruptures, this is what we call ovulation, and normally there will be semen released, and this semen can come in, the male sperms can come in, and then they can meet around here, and then fertilization can take. So thank you once again, my friend. We are proceeding with the whole process of ovulation, and we have said that when the egg has been released on the 14th day, basically this is what we call the day of ovulation, or the day when you are most likely to get pregnant. But still, the 3 to 4 days leading to ovulation, still you can get pregnant. Having talked about this, we are going to answer our question: is it possible for a woman to get pregnant when they have only one fallopian tube? The answer is yes. It is very possible. The most important thing you have to do is you need to understand your ovulation calendar, and then also you need to understand that when the fallopian tube is not blocked, and the fallopian tube does not have any issues with maybe fluid inside it, then there are high chances that you can easily get pregnant. What you need to do, or what you need to know, is that the fallopian tubes should be patent, or they should be open. It is very easy for a woman with a fallopian tube which is open to get pregnant, as long as the tubes are open, and then as long as this particular woman is actually ovulating very well. So when you are a woman and you ovulate very well, and you have one fallopian tube which is not blocked, then you can easily get pregnant. Though in most cases there are times when your fallopian tubes may be blocked, still this has to be confirmed by your doctor, whereby an investigation will be done. This investigation is known as the HSG, or the hysterosalpingogram. It's an examination whereby your fallopian tubes will be analyzed under a special technique, and when the report comes out that your tube is blocked, unblocking can be done in hospital. So we are talking about how to get pregnant faster with one fallopian tube and how to boost ovulation naturally with just a simple recipe. And we have said that during the process of ovulation, as long as a woman is ovulating very well until the 14th day, she can always get pregnant faster naturally. And then the other most important thing is that you need to understand how your cycle runs. You need to understand that if you are a woman and you have a cycle that runs for 22 days, then the days you are ovulating are going to be between day 6 and day 10. And then if you are a woman and your cycle runs for 24 days, then the days of ovulation are on day 8 and day 12. All together until when you reach 45 days, still the days of ovulation are between the 26th and the 30th day. So having known all that about the menstrual cycle and then the calendar method, we are going to talk about one simple recipe that can help you get pregnant faster, and this is what we call citrus fruits. Citrus fruits are very, very important. It's actually very important because it contains lots of vitamin C, which is very important. It is very key in handling, and it acts as an antioxidant, and it basically works on free radicals in your body. But in fertility, in managing fertility cases, it actually boosts fertility because it contains a very important element. It contains a very important substance known as polyamine putrescine. Polyamine putrescine is very important because it has been known to boost egg quality, and then also it has been known to boost sperm quality. So if you are a woman, if you are a couple trying to get pregnant, make sure that you consume some citrus fruits because they do contain polyamine putrescine, and then also they do contain they actually contain vitamin C, but in this particular case the polyamine putrescine is very, very important because it boosts sperm quality and then also it boosts egg quality. We have been talking about how to get pregnant faster with one fallopian tube, and we have said that you just have to make sure that the fallopian tube is not blocked, and then you should be ovulating very well. If you are not ovulating very well and the fallopian tube you have is actually blocked, then it may be a bit difficult to get pregnant faster. The other thing is that how to boost the ovulation basically faster. You basically have to go on and then take lots of citrus fruits because they do contain polyamine putrescine, and then also polyamine putrescine has been known to boost sperm quality and egg quality. According to a study which was done by Dr. Murphy, polyamine putrescine is known to boost sperm quality and egg quality. Gerard Massa, the health educator, is the name of the channel. I welcome you, my friend. I thank you for staying with me for this while, and I hope you have learned something in today's video. What you need to take home is that you should take lots of citrus fruits if you are a couple trying to get pregnant, and then the next thing is you should know that you can get pregnant easily even if you have one fallopian tube, as long as you are ovulating well and then as long as your fallopian tube is open. You can connect with me on my WhatsApp numbers. They are just around the corner down here on the right side. You can connect with me in case you have any questions. Also remember, what is a baffling cyst? In this video today we are going to talk about the baffling cyst. Hello my friend, I welcome you to our channel, Gerard Massa, the health educator. On this channel we talk about the ovulation calendar, we do talk about the ovulation calculator, and we do answer all your questions in regards to women's health. Ask all your questions down below in the comments. I will answer all those questions personally. Remember to subscribe so that you watch new videos we release every day. I welcome you, my friend, for today's lesson. Welcome for today's lesson. Be attentive, watch the video up to the end, and you are going to benefit a lot. Would you like to get pregnant faster? Would you like to get pregnant naturally? Then this video is for you. by the end of this video, you are going to know what a Bartholin's cyst is and what is a Bartholin's cyst and how best it can be treated. So without further ado, we shall be define a Bartholin's cyst, and we shall say that a Bartholin's cyst is called a duct cyst, and it is a fluid-filled sac just inside the opening of a woman's vagina. So what is happening is that when you are a woman and you have a small swelling which is filled with fluid just inside at the opening of your private parts, then this could be a Bartholin's cyst. So we are going to look at the symptoms of a Bartholin's cyst. You may feel a soft, painless lump. This does not usually cause any problems, but if the cyst grows very large, it can become noticeable and even uncomfortable. So you may also feel pain in the skin surrounding the vagina, that is the outer skin known as the vulva, when you walk. And then even when you sit down, and this pain increases when you have sex. So the first symptom is that you are going to feel a soft, painless lump which is just at the opening of your vagina. The cyst can sometimes affect the outer pair of lips surrounding the vagina, known as the labia majora, and specifically one side may be very, very swollen. If the cyst becomes infected, it can cause a painful collection of pus known as abscess to develop in one of the Bartholin's glands. Signs of an abscess include the affected area becoming red, swollen, tender, and even hot. Remember to subscribe for new videos we release every day, and in this video today we are talking about the Bartholin's cyst. So if you are a woman and you have a high body temperature ranging from 37, 38, even going to 39, and you have a small swelling just at the opening of your private parts, then this could be a Bartholin's cyst. Remember, if the temperature is rising, it means that the infection, or it means that the swelling is becoming septic, or it is actually getting microorganisms multiplying and going into your bloodstream, and you should see your doctor immediately if you are a woman and you have a small swelling just at the opening of your private parts. So small Bartholin's cysts are sometimes found during a routine cervical screening test. This could be a test for cancer, but still your doctor or your midwife will see a small swelling just at the opening of your private parts. This examination may be carried out for another reason, but just as they are examining you for maybe cancer of the cervix, they may discover that you have what we call a Bartholin's cyst. Next is that you can also develop a lump in the area around your vagina, so the diagnosis has to be made by your doctor. In some cases, your doctor may recommend that you have a biopsy whereby a small piece of tissue is got from that swelling using a special needle known as a Finac needle or a fine needle aspirator. It is very, very important for this to be taken, because sometimes you may think that it is a normal thing, but you may actually think that it's not really harmful, but it can easily develop into something as serious as vulval cancer, also known as Bartholin's gland cancer. What are the causes of Bartholin's cysts? What are the causes of Bartholin's cysts? The Bartholin's glands are a pair of pea-sized glands found just behind either side of the lips of your vagina. So these are a pair of pea-sized glands, meaning that they are just around the size of pea, that is PEA. So they are just the size of that pea, and when I talk about pea, I'm meaning these peas which are actually cowpeas, these peas which are eatable. So Bartholin's glands are around that size, that is PEA. So what is happening is that the glands are not usually noticeable because they rarely become larger than 1 centimeter across. The Bufferlin's gland secrete fluid that acts as a lubricant during sex. So the main function of the Bufferlin's glands is that they secrete fluid that acts as a lubricant during sex. The fluid travels down tiny tubes called ducts into the vagina. If the ducts become blocked, they can fill with fluid and expand to form what we call a fluid-filled cyst, also known as the Bufferlin's cysts. It is often not known why the ducts become blocked, but some cases are linked to STIs or sexually transmitted infections, for example, chlamydia, gonorrhea, and even other infections brought about by E. coli or Escherichia coli. How are Bufferlin's cysts treated? If you do not have noticeable symptoms, it's unlikely that you will need treatment. So in this video we are talking about Bufferlin's cysts. We have talked about how they present. We've said that they are normally, they begin from the Bufferlin's glands, and the Bufferlin's glands are around the size of P, that is PEA, cowpeas, and then normally when they get blocked, then when they do get blocked, then it means they are going to be filled up with fluid, and this is what we call the Bufferlin's cysts. If the cyst is painful, your doctor may recommend some simple self-care measures, such as soaking the cyst in warm water several times a day for 3 to 4 days, and taking painkillers you can buy from your pharmacy or a nearby hospital. If these painkillers do not help relieve, if you apply the warm compresses and then you do even take the painkillers like acetaminophen and they do not help, then several treatments are available to treat the Bufferlin's cysts. So it is very, very important that when you have a Bufferlin's cyst, you should be able to get treatment, and the best way of preventing Bufferlin's cysts is that you should practice safe sex. That is, you should use a condom whenever you have sex, and also you should be having sex with only one person who is trusted. Thank you once again, my friend, for watching our video. Gerard Massa, the health educator, is the name of the channel, and in this video today we have talked about the Bufferlin's cysts, and we have said that these are swellings which become of the Bufferlin's glands, and normally they happen due to blockage. I welcome you, my friend. Thank you for watching today's video. Remember to subscribe if you are new here. Remember to check our videos. Tomorrow we shall be releasing more videos at exactly 17 hours. Thank you for today's lesson, and have yourself a fantastic and healthy day. Bye-bye. Thank you, my friend, for attending today's lesson. I hope you have learned something, and please, if you have any questions in regards to what we've just discussed, leave your questions in the comments. Ask me your questions. I will answer all your questions. On this channel, Gerard Massa, the health educator, I talk about women's health. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye. To subscribe for new videos we release every day. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye. Thank you, my friend, for attending today's lesson. I hope you have learned something, and please, if you have any questions in regards to what we've just discussed, leave your questions in the comments. Ask me your questions. I will answer all your questions. On this channel, Gerard Massa, the health educator, I talk about women's health. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye.